Hello, my name is Emma. Today is April 5th, 2025, and in this discussion video, I chose an article called News Influencers, Opioid Disparities, and AI Bias in Healthcare from KFF that discusses and addresses misinformation about naloxone as opioid overdose remains high among Black and Indigenous Americans. Opioid death rates began to show signs of decline across several demographic groups by 2023. The high vulnerability of AIAN in Black populations persists, reflecting broader systematic changes and challenges, including limited access to treatment and harm reduction resources. Prior to naloxone becoming more widely available, there was misinformation about this drug, contributing to this health disparity, such as the incorrect belief that naloxone leads to increased substance use, fear of police harassment for carrying naloxone, or being accused of drug possession. I got this information from the resource Washington and Yilma 2025. All of this information can deter people from accessing or using naloxone, especially given the intersection of criminalization and substance use. Additionally, the article touches on the stigma and the false claims about harm reduction programs that aim to address these crises, noting that despite evidence to the contrary, such programs are often misrepresented in public discourse. One key disparity highlighted in this article is the racial disparity in opioid overdose deaths, particularly affecting Black and Indigenous communities. This disparity impacts health care in several significant ways, one being stigma and misinformation. There have been recent misleading claims about harm reduction strategies where two former top officials at the Department of Health and Human Services published an op-ed on Fox News claiming that the current administration's harm reduction strategies have produced more harm, not less. I got this information using that same resource I cited before, Washington and Yilma 2025. According to KFF, the article continued to spread on social media platforms where many posts and comments advocated against harm reduction, falsely claiming that harm reduction can promote drug use and discourage treatment. Additionally, misinformation around harm reduction programs such as the use of naloxone can prevent individuals from getting timely help during an overdose. Investigators have found that negative attitudes about patients with substance use disorders, including opioid use, have resulted in strained patient-provider collaborative relationships, shorter visits, and task-oriented approach to treatment. I got this from Garrett and Young 2022. Another disparity includes access to treatment. Black and Indigenous communities may have less access to opioid use disorder treatment options, including medications like methadone or buprenorphine, which limits their ability to effectively manage addiction and reduce their chance of recovery. Building trust among providers, patients, and community members will be important in destigmatizing opioid use disorder treatments. Engagement by providers online and increasing electronic health literacy by patients may diminish the spread of misinformation, and community initiatives can also help normalize treatment of opioid use disorder. I got this from the site as well, cited before, Garrett and Young 2022. To improve racial disparity, opioid overdose deaths, particularly in Black and Indigenous communities, increasing access to treatment, addressing the stigma and misinformation of the disparity, and increasing diversity in healthcare leaders, working towards reducing the racial disparities in opioid overdose deaths, ensuring that everyone has equal access to the care and resources they need to overcome addiction and stay healthy. Even if we increased funding for research in opioid use and overdose deaths in marginalized communities to better understand the root causes of these disparities and the most effective interventions would be beneficial. In summary, addressing the racial disparities on opioid overdose deaths, particularly in Black and Indigenous communities, requires a comprehensive approach that includes expanding access to addiction treatment, reducing stigma and misinformation, and improving cultural competency within healthcare systems. Additionally, increasing research, collecting more disaggregated data, and ensuring equitable access to harm reduction programs are key to effectively addressing these disparities. By implementing these strategies, we can create a more inclusive and supportive healthcare environment that ensures everyone, regardless of race, can receive the care and resources needed to combat opioid addiction and improve health outcomes. That is all I have. Thank you.